Hello, my name is Shiroz Akhtar. I am a third-year medical student at the University of Tennessee Health Science Center, and I am pleased to present my research on behalf of myself and my mentor, Dr. Yasser Akhtar from Tenova North in Knoxville. We present to you a case series representing the outcomes of percutaneous mechanical aspiration, PMAD, of tricuspid valve endocarditis compared to surgery, specifically in the demographics of IV drug use. IV drug users are associated with tricuspid valve endocarditis, and the mortality is very high due to the sequelae of the illness, such as septic pulmonary emboli and hemodynamic instability. Significant tricuspid regurg can develop as well. It is associated with a high mortality despite surgical debridement and antibiotic therapy. Therefore, we explore the use of an alternative option, a non-invasive approach, which is PMAD, percutaneous mechanical aspiration. Of these endocarditis, these TVE vegetations in patients who are high risk for surgery and refractory to antibiotics. So in this case series, we um, review 89 patients with IV drug use from 2013 to 2021 at a single hospital who presented with isolated TVE undergoing either surgical debridement or PMAD. And we analyzed our findings. All those patients considered for percutaneous aspiration were evaluated by CT as well as ID. They were deemed poor surgical candidates and were exempted from surgical intervention. So we use SPSS to evaluate our data, and we use Pearson's chi-square testing as well as t-test values to delineate the significance. Briefly, through our how we conducted the intervention, the aspiration was performed using moderate sedation under ice, intracardiac echo guidance. Aspiration was performed using the Penumbra Cat 8 and Lightning 12. All specimens were retrieved and sent to pathology for analysis. As you can see on the right, we have the results. Two areas of significance were the average length of stay and the in-hospital survival. PMAD was associated with half the length of stay of surgery, about 17 days compared to 34, and PMAD was associated with a higher in-hospital survival at 92% compared to 73.9% seen in surgery. In addition, the recurrence of endocarditis was lower with PMAD. In conclusion, we believe PMAD to be safe and feasible alternative option in isolated tricuspid valve endocarditis, and it may be associated with improved outcomes as well as a decreased economic burden on the healthcare system overall due to the decreased hospital stay. However, further prospective studies are needed to evaluate the long-term efficacy of PMAD compared to surgery. Briefly, I just want to show a demonstration or an example of a tricuspid valve vegetation. As you can hear, this is the tricuspid valve, and it has a very floppy, large vegetation. And this is an entry of our aspiration system. As you can see, the more rigid stick is the ice probe, which gives us the guidance and visual of the heart, and the workhorse wire that is entering the right atrium at the level of the tricuspid valve and following is the device catheter. And here finally is an example of the aspiration of vegetation. As you can see, the vegetation gets quite nicely sucked up into that cannula of the aspiration device. That concludes my presentation. Thank you